Good afternoon, everybody. My name is Michael Gargano, and thank you for joining us for this very important talk. And I'd like our guest to introduce herself.
Hi, I'm Dr. Nathaniel Granger, and I'm just very happy to be here.
And I first met Dr. Granger when I was a doctoral student at Saybrook University, and his most memorable moment that still is impressed in my mind was when he gave his I Have a Dream speech, his embodiment of the Dr. Martin Luther King speech. And we later began to talk about all types of issues, healing, racism, institutional oppression, your dissertation research on microaggressions, the lived experience of what it means to be a person of color in academia and in the world, and transformative social change. So thank you for joining us today, and I feel very honored to be able to have this interview with you.
Well, thank you, Michael. I'm very, very honored to be here, and I just look forward to just sharing a little bit of my story as far as structural racism and microaggressions and the intersection with chronic pain and recovery and I don't know where it's all going to go, but my hope is that there will be a nugget in what we're talking about that would touch a life.
Yeah, for sure. And I appreciate that. And so for our readers, can you identify and define for us a little bit what institutionalized racism is and systemic racism?
Yes, it is. And I don't have the formal definition in front of me, but it is racism that is it's systemic racism. It is a system that is predicated on racist values and sustained through maintaining those racist values and to the extent of oppressing others who don't ascribe to those values.
So it's about a dominant culture kind of creating the space for a culture that they don't identify with, and really it's the power and control model.
Oh, absolutely. Yeah.
And so what led you to this line of research in your life and in your profession overall?
Well, as an African-American male and growing up as an African-American male in inner city Chicago, it didn't take long. In fact, early on, maybe from birth even, I knew that there was a separation between black and white, and I knew that somehow I was a victim of racism without even knowing what it was. I knew that there was something, and that something I later discovered was microaggressions, which are these denigrating messages that are these put downs that are towards marginalized groups. These things that these subtle messages that let me know that I am different or that I don't fit in. And so so it led me to the research on again, I didn't know the term, but I knew it was something out there. And I discovered that something was microaggressions, and coming to realize that even under the umbrella of microaggressions, that many microaggressions that take place daily are under the umbrella of good intention. And so even in a structural racist society, there's more racism, or the implications of racism are more prevalent under the umbrella of good intentions than they are bad. And so yes, we see a lot of wrong social injustices. We see a lot, but what we see is only the tip of the iceberg.
Yeah, and a lot of it from my own experience, even having to work through some of that as a clinician, is it's subtle and it's nuanced, and being able to say, as a person, I'm engaging in some microaggressions. I think is part of the healing conversation and helps us to bridge the gap so that we're not as far as we once were. And can you speak to how we bridge that gap a little bit?
Now, help me understand, Michael, when you say bridge the gap, the gap between between race, or the gap between uh,
So the gap between how we heal kind of. Yeah, sometimes people come into the world thinking, I'm not aggressive. I don't engage in these things called microaggressions. I'm not a racist. So how do we begin to kind of take the veil off to say many people in the world engage in this, and it doesn't by default make you a bad person, and so how do we do this work so that we can really heal from the inside out in order to heal our culture?
well, one of the things that I find is very important, is to disarm oneself. Whenever race or uh, discrimination or anything around the topic of race, whenever that comes up, there tends to be a visceral reaction that puts people on guard, because either they are the racist, or they are the offender against racism, and so it sets up a conversation for a fight. And so I think the first thing to do is that we have to disarm ourselves when we even enter into those discussions, and when we enter into the work, we can't come into it fighting, so to speak. There is a way to fight, but it's a fair fight. And actually, I like to use the analogy of dancing as more of a dance than a fight. And with dancing, you take hold of your partner's hand, and you kind of guide them, and you may spin them around. Sometimes you may even dip them. They may fall very, very low to the ground, and they come back up, and you may step on their foot, step on their toes from time to time, and likewise they may step on yours, but you remain on the dance floor. You don't leave the dance floor. And I think that's really critical in doing this work. And so as you are doing this dance, you disarm yourself, and you're no longer a threat. And so it makes the recipient of the knowledge of microaggressions a little bit more, they're a little more open.
Yeah, and I'm really actually captured by this metaphor that you're giving us of dancing, and I'm sitting here kind of moving a little bit as you're saying that. And I think, this idea of being able to be honest, open-minded, and willing to go into this pain is a way to heal some trauma, some wounding, if we understand trauma as a wound, that microaggressions wound the person. There's a lot of talk, I'm an EMDR trained therapist, and someone once wrote a book about oppressive cognitions, and I think you named a few of them,
Mhm.
and so it's been my experience with working with people that sometimes people that I work with have operated from Black is not beautiful, that I have been taught that either by the media or growing up with this intergenerational trauma. Can you
Yeah.
speak to that a little bit?
Well, yeah. Oh my God. A few things that came up in what you were saying. The word pain, and just pain within and of itself is to me is a very charged word, because it speaks to physical pain. We could speak to emotional pain. We could speak to um, uh, uh, uh,
Spiritual.
spiritual pain, certainly, and then cultural and universal pain. And what we find ourselves in now, dealing with the COVID. There's a universal suffering that's taking place. We feel, we feel the impact of COVID. And so And so when I look at pain, just that why I say it's charged, certainly when I hear it, but it also it's very personal to me in that I live with chronic pain. And with that, with living with chronic pain, I have had to maneuver through a structurally racist society in order to maintain, as it were, my masculine privilege in white world, all the while dealing with a physical pain. That physical pain is certainly exacerbated by systemic racism, and research shows that um, uh, be it microaggressions or be it blatant racism, that people of color life expectancy is about 10 years less than their white counterpart. We suffer more psychosomatic symptoms. We suffer more physical symptoms that are brought on due to inflammation, diabetes, heart disease. And this isn't just a result of diet. This is a result of lifestyle, and compounded by the inequities in healthcare. And so dealing with the physical pain, then we have to deal with the systemic pain, the pain that is caused by a system. But then too, culturally, as a culture, there's a pain that we carry. I can't identify with my great 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 grandfather being a slave. I can't physically, I can't consciously identify with that. However, I bear that in my DNA. Yeah, matter of fact, the research shows that even with PTSD, when we do trauma work, one doesn't have to experience the trauma to be a recipient of that trauma. You don't have to directly experience it to be a recipient and exemplify those symptoms of trauma. And so trauma within and of itself is passed down generationally. And so I carry that generational trauma. When and I don't want to go off on a tangent here, but when George Floyd was murdered just in the recent months, I wept as if that was my natural blood brother. I wept and it was a weep, and it was a cry that came from my soul. It came from somewhere else, but that somewhere else was very much a part of me. And so trying to even identify with that, wow, I'm hurting here, but it's not a physical pain. It's not just a psychological pain where I think something bad just happened and I try to process that. No, it was a pain that was very, very existential. It was a pain that was very uh, much deeper than the surface. And as we talked a little earlier before, I think we chimed on and we talked about racism and how so much of it is under the umbrella of good intent, and of all the bad things we see, that's only the tip of the iceberg. There's so much more underneath that, and the same thing it is with pain and living with chronic pain, and then again living with chronic pain as an African American male.
Yeah, and thank you for going there. I think it's an important piece that we need to kind of dive deep down into, especially in the era of people saying all lives matter, which is invalidating to the experience of people of a particular section of our population that historically hasn't always mattered, and now is this awakening both culturally, psychologically, I think, and systemically to say we need to heal this culture. And by doing that, we need to look at the ugly side of our world, which has been abuse, and that abuse has carried intergenerationally and in between family systems. And yeah, I think there's just a lot there that we have yet to tap into. And this existential piece that you bring up seeing the news and then evaluating, who am I? What is my worth? Where am I going? How do I work within a system that sees me as someone that's disposable at times?
Oh, absolutely, absolutely, and it's a difficult cross to bear sometimes, and it's one that so many people give up. People, when you carry such a burden, it is very exhausting, and it stands the reason why those who have to carry such a burden, their life expectancy is shortened when you have to carry such a a burden for so many years. I mean, if you think about microaggressions, one microaggression is enough to cause some, a very, it can cause quite a bit of trauma. It can, I know the old adage, sticks and stones may break my bones, but words can never hurt me.
It's
Well,
bullshit.
words hurt worse than I'd rather for you to beat me than some of the words I've heard. And so you figure one microaggression can cause damage. Just imagine microaggressions that are by definition, it says these are daily. These are daily denigrating messages. To be told daily that you are different, or to be told daily that you are broken. When I look at the LGBT community, we have as a society, we have, implied for generations that if you are LGBTQ or you of this community, something is wrong with you. I'm dealing with the case right now where the young man is struggling because his dad is very, very homophobic, and this kid is actually very, very homophobic, which is a red flag within and of itself. I mean, he's very homophobic, but when exploring the bottom line is that he's actually gay, but in his family he can't be gay.
Internalized oppression.
Yes, absolutely. Good point. This is so. I mean, this, and so this adds to the pain. So imagine, living with the pain, first of all, of being of a marginalized group. If you're blessed, so to speak, with the stigma of being of a marginalized group, if you're blessed, so to speak, of being African American male, stigmatized, so to speak, in white world, the last thing you want is another stigma. And so this is one of the reasons, this is one of the challenges you and I are finding now in mental health, where people of color are not, they're not seeking mental health, services. Why is that? Because number one, they don't want to be stigmatized. They try to avoid the stigma that is associated with mental health. And so you mentioned, how do we heal from the inside? First of all, secondly, apart from, my first point, I want to say, secondly, we have to remove the stigma around mental health and the stigma around being different. We have been programmed or conditioned to believe that different means broken, or different means something is wrong, and that difference is based on a Eurocentric perception. That white is right, and it has to be a certain way. It has to be the white is right. In fact, the medical model is predicated on white physicians coming together, and and it's this white Eurocentric model. And I needless, let me say white heterosexual Eurocentric model. So to heal from that, to heal from that is not a one-time treatment. I can't just take a pill and abracadabra, I'm healed from this. this is something that I have found quite disturbing during this time that we're in, with well-intended white advocates for Black Lives Matter. I have gotten numerous calls and numerous emails, and where different ones have jumped on this bandwagon and they want to, so to speak, save a culture. And I'm very thankful for that. I'm very grateful for wanting to help. But when you come at it from a place of privilege and there's no humility, you want to be the knight in shining armor, so to speak. You want to be the rescuer. That within and of itself is still very microaggressive. And so now I'm hurting, and in you trying to help me, you've only added salt to my wounds. And so how do I deal with that? So now I'm struggling with my pain, and but also I'm called upon to help you with your stuff and help you better understand that just because you took a course in multiculturalism, you cannot check off the box that you are an advocate for diversity. Mm-hmm. And so
yeah. And thank you for going there. You know, especially on Facebook, it seems like I'll call this white saviorism. And, you know, I'm playing Jesus Christ, and I don't mean that to sound trite. And I have to save this people. But I think part of what draws me to you and our conversations has been this thou relationship, that we treat each other as human beings and we learn from each other. Do we get things wrong sometimes? Do we miss the mark in the dance, as you spoke about? Sure. But Absolutely. Can I embrace you as an authentic human being? And from that place, how do I take what I hear as your pain and the struggles that you've been to, and not convince other people of color that they've been through that, but then to say to people that have white privilege or people that embrace white supremacy, listen, you're part of the problem, and here's how you change it. I read this great book called A Medical Apartheid. I don't know if you've read it. It's about how people of color have been treated in the system of medicine and psychology. Schizophrenia was often used as a protest diagnosis to suppress, you know, people from wanting to take some social change. Black bodies were experimented on, the Tuskegee experiment, which I know you're familiar with. That legacy still continues today in the health disparities that we see. So I think, you know, what I'm hearing you say is we need to do our own work to investigate and be advocates from the side of, not to save people, but to say, you know, we're equally part of the solution as much as we are part of the problem, as people from a place of privilege.
Yeah. I you know, with the savior mentality, it further adds to the notion that African Americans don't matter, or that and when I say don't matter from a human perspective. And I think it's so important to that we really have to get to a place of humanizing one another. I think that's one thing. You and I, we have this thing, we can get on the phone and talk forever. We humanize each other, and we validate each other's humanity. And I think I think that is very beautiful. And I found that to be very beautiful in interactions with others, you know, whether it's inside the therapeutic setting or the classroom. But even as we go through our daily lives, we go through with the mindset where we recognize humans, we recognize their differences, and we validate them. Even today, and even that is not a one day thing. It's not a course. It becomes an act of our will. We have to internalize this to the extent to whereby this is how I'm gonna make a change, where I'm gonna be a better human to myself, and therefore for others. When we hear the rebuttal to Black Lives Matter with all lives matter, what pisses me off so much with that is because it's not so much the words that all lives matter, because all lives truly do matter. So it's not the wording, it's the place from which those words are coming. Those words are coming from a place of superiority and a rebuttal against those who have been historically treated less than, not even as full humans. Even in the Constitution, it said that Black people were like 2/3 of a human, I think it was. And so we weren't treated as humans. And so when you say, when you rebuttal when you rebuttal with all lives matter, you are again saying that Black lives really don't matter, and I refuse to value their experiential reality. You invalidate the experience of Black persons once again. When I look at the study of microaggressions, there are 3 types of microaggressions: microassaults, which are demonstrated by derogatory slurs, racial slurs. You have micro insults, which can play out in, for instance, hanging a noose somewhere. And then you have micro invalidations. Micro invalidations are the most insidious and yet the most harmful of all microaggressions. These micro invalidations, what they do, they deny the psychological and the experiential reality of marginalized groups. That's terrible. That's terrible within and of itself. But then on top of it, then there's an imposition of one's reality onto that marginalized person or the marginalized group. And to impose your reality onto another person is the ultimate form of oppression. And so yeah, we have to get down and dirty in all of this and get our hands dirty. But in doing it, we do it humanly, recognizing that all parties, all players are first and foremost part of the human race.
Yeah, and as you're speaking, what's coming up for me, I still have this image burned in my mind, is my first semester at Saybrook, when someone hung up a Black Lives Matter poster, and another person in the middle of the night took a marker and wrote "All Lives Matter." And that image, I've shared it a number of times, and I use it as a talking point a lot, is that is an invalidation. And it's from a place of fear, I believe,
Yeah.
that I can't hear, or I'm unwilling to, because I might lose my privilege. And that was at a doctoral institution. That was at a place where supposedly we're supposed to be able to, I mean, to change these, the program had a transformative social change program.
Yeah.
You wouldn't think that a place of that type of learning, but it does. No institution is devoid of microaggressions or the re-traumatization. And so what I'm hearing you say is a call to action, both for therapists, for educators, and for laymen and women and people to really do their own work and not sit in the comfortability of, well, it's been this way for 300 years. Why change now?
Yeah, 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 yeah. Oh God, I mean, my mind is in so many different places with this particular topic here, and even as I deal with uh, uh,
Pain.
physical pain, uh, I know I understand the psychology of addictions and how that all plays out, and how people who deal with chronic pain often they medicate really to lessen the symptoms of pain. But just as you should, I'm not going to say people do this, just as you should do the work with your personal pain, you should also do the work with your psychological pain, your spiritual pain, your and even your cultural pain. I don't care what one's race is. One thing that is common to the human condition, and that is trauma. We have all been traumatized one way or the other, and that trauma has impacted us, and we react as a result of that trauma. Many of us are angry, you know, and it plays out in as anger. But even in that, you know, recognizing, where's this anger coming from? Anger is a secondary emotion to pain. You know, there's some hurt there. So, you know, we want to treat the symptoms all the time, but we don't want to treat the underlying issue. And so even with chronic pain, there's some pains that I have learned to recognize in my body that, okay, this isn't just physiological. Okay, this part of this pain has there's a psychological component. Then there's a spiritual component. There's a psychological component because, you know, even though I don't feel too bad, but psychologically, you know, I feel bad because I get treated. The pain itself gets treated and the symptoms get covered if I can psychologically grasp the fact that I feel bad. And so, man, it takes so it's a day-to-day work. It's a day-to-day, it's a never-ending work. And so living with physical pain, you know, I have not had a day and maybe, I don't know, 25, 20, I lost count, at least a quarter century where I have been physically pain free. I have not had a day where I have been physically pain free. But I refuse to let that become a part of who I am, so to speak, and in my presentation to others. You know, hurt people hurt people. And so it stands to reason, if you're living with a whole bunch of pain, you can hurt a lot of other people. But when you get a handle of that pain, when you come to realize that, yes, I have pain, but I refuse to let the pain have me. It's the same thing with, and I don't recommend this. This is something they don't teach us in school, and many clinicians will beg to differ. But with addictions, same thing with addictions. I had to learn, because living with pain and trying to lessen the symptoms of the pain, you know, with medications and just drugs, and then growing up in an atmosphere of drugs and alcohol. And I remember a time in my life where I was, you know, doing my spiritual journey, where I was taught to abstain from alcohol and to abstain, you know, to the extent to whereby you don't come near it, don't have it even around you. Well, that teaching didn't work for me, because the more it wasn't around me, the more it was drawing me. And it still had power over me because I was trying so hard to avoid it. So I was giving it power. But it wasn't until I realized that, no, I can have this. It's not having this, whatever it is not bad within and of itself or by itself. It's me who make it. I make it that way. And so if I can make something bad, if I have that power in me to make it bad, I also have the power in me to make it good. And in making it good for both me and the drug, or me and the substance, or me and the alcohol, and making it good for the both of us, so to speak, you know, I incorporated that into my own way of healing and treating myself. And that is, yes, I can have it, but I refuse to let it have me. And so I'm not a smoker. I don't smoke, but I remember some years ago I did smoke. And the topic of smoking, when it comes up, is the thing is, I always hear, well, if you take a puff of cigarette, if you take a puff, then you're gonna be addicted again. You're gonna go back to smoking cigarettes. I don't believe that. I don't believe that if I take a puff of a cigarette, I'm going to go back to smoking a cigarette. I don't believe that. And I guess I don't believe that based on my own way of dealing with addictions, is that I can have it if I wanted it, but I don't even want it. The desire is not even there. But if I did, it still can't have me. I refuse to let it have me. And so what I've done in all of that is finding a place where, despite the societal injunctions that have been put on me as an African American male, I have to counter that the best way I can with affirmations. And so with every negative thing that I've been taught, I have to counter that with I know I am somebody. I am gonna make it. I'm not just some people say another, the N word. No. So yeah, I know I'm on a tangent here, but I just
No.
I love it. I love it, and I just hope that I hope it could really inspire somebody to, God, man, because I just see
You're
it
giving me a
even with
lot
my.
of gold here.
Hmm?
You're giving a lot of gold here, and I actually wanted to plug this book that you asked me to review some years ago, Silent Dreams: Poetic Journeys Through Addiction and Recovery. And
Yeah.
another piece that draws me to your work is you have a very expressive arts and creative outlet, both as a minister and as a clinician and academic. And if you could speak to the healing power of how poetry and music and movement have been part of your healing journey as you work to deal with chronic pain, but also within this context of systemic racism, trauma and wounding, and the sense of integration of how do I have this bigger meaning and purpose in life, given all of these things.
Creativity is to me, it is the key to a well-rounded and uh, joyful life. I'm not going to say happy, because happiness is circumstantial, but there's joy you can have despite your circumstances, and that joy is really predicated on creativity and how we learn how we learn to create, even within spirituality. My religious belief, my religion, so to speak, if I can say that, is I had to find. I mean, years ago, I realized that my religion was incongruent with my spirituality. And so I was like, oh no, yes, I embraced this certain religion, but it was so, it there was some incongruence there. And so with that, I didn't, instead of me throwing out the baby with the bathwater, I've learned to I can hold on to the baby, as it were, and throw out the bathwater. And so I eat the meat and I spit out the bones, because there's a lot of crap. There's a lot of, in man's philosophies, whether it's religion or any other type of philosophical tenets, it's all man-made, and we all have our different beliefs, and people have thrown their beliefs in. But you have to be creative enough to not just take what philosophy is telling you, or take what man has told you without question. It's particularly if it goes against your inner being. If it's going against your inner peace, then you need to question that. And I'm not talking about the physical pain. I'm talking about that inner man, that piece that doesn't, that that part on your intuition, all of those pieces of you that is tied to your existence. That
Existential piece.
yes. And if it caused some existential angst, then question it. There's a reason why that's there. There's a reason why you feel that. And so even with this piece here, Silent Screams, Poetic Journeys Through Addiction and Recovery, this is part of a poetry series that actually started with the first book being one that Lewis Hoffman and I did, was which is called Stay a While, um, uh, poetic narratives on multiculturalism and diversity. And one thing we have found that with poetry or music or even art, I just finished a painting this week on um, um, uh, part of a COVID series that I call myself working on. I don't consider myself a painter, so to speak. I'm gonna grab it. It's right behind me. Hold on one second.
Sure.
So I was just working on this piece.
Wow, it's beautiful.
And this is a place in Colorado Springs. And I go up there to the park, and there was a guy there with a red hoodie, and he had a mask on. And so,
Wow, it's
so
beautiful.
so yeah, so just even grabbing a piece of canvas or a brush or trying to make music, what it does, it frees the mind. It frees the mind from its normal state of incarceration. We are so incarcerated by our minds that we don't allow ourselves to travel or to be free, free to express. And one thing I found with poetry is that it frees me to just, there's no right or wrong. There's no judgment with poetry. Whereas with anything else, you know, with whatever you do, there's always someone standing around wanting to judge you, you know. And what happens is when those people are no longer around, then you are around standing there to judge yourself. Well, poetry helps you not to judge yourself. And this frees you, this liberates you to a better state of well-being when you can rid yourself of those judgments. Because the truth of the matter is, we all have issues because we're all human. And it goes back to that humanizing others, but also too, we have to humanize ourselves. And poetry, it really helps me to humanize myself.
Yeah, and I have that same spirit. I'm thinking of this painting right next to
I'm
me.
loving it too. Yes.
And people would say to me when I first started, "That's not art. That's not art." You know, Jackson Pollock had the same criticism, but I'm like, it makes sense to me. It's probably an internal process that I was going through in the moment. I don't remember what it was about. But I'm also thinking you brought up the issue of LGBTQ and sexuality, and also how that ties in to living out kind of your authentic truth. And I'm thinking of a friend from college, a guy by the name of James, who said, you know, he was a man of color, and he said, "I'm gay and I can't live that life." And I said, "James, just be who you are," you know, and that caused a lot of internal, he was a great writer, you know, brilliant minded. And until he really could accept the fact that he was who he was in the world, with, like you're saying, without judgment, and honor that piece, that's, I think, where the conversation about healing and dealing with wounds has to come from, related to also, you know, how we deal with pain. Until I deal with the psychological stuff, my somatic, you know, physiological experiences are going to continue to torture me. They will torture me a little bit less, perhaps. I'll still have them if I have chronic pain. But until I deal with the inner turmoil of a world that doesn't embrace me, that's, I think, what I hear you say is the real healing and transformative process.
Wow, that it touches my heart to even hear you say that, because it is so it's so very real. You
Mm-hmm.
know, if no one else can embrace me, I have to somehow embrace myself, so to speak. I have to be able to love me. But you know, let me say something too. It's not selfishness though. It
Mm-hmm.
sounds selfish when I say that I have to be able to love me. That sounds selfish to me.
It's self-care.
It's self-care. It's not selfish, it's self-care.
I honor myself so that I can honor you. You
Yeah,
said it, if I'm wounded and I wound the world, if I heal my wounds, I can help heal yours.
that's
It's
right.
what Henry Nouwen would call the wounded healer.
Yes. Yes,
And
indeed.
you know, we're all wounded healers.
Yeah, yeah. Um, and that humanizes it as well. That humanizes it. there's a song called Joy, and it's a gospel, modern gospel song by Vashon Mitchell. But the lyrics of the song, there's a caption in there that says, "There's beauty in my brokenness. There's beauty in my brokenness." And that song, those words so resonate with me, that beauty in my brokenness, but not just mine. There's beauty in your brokenness. When I see people, I was driving today, and there's a woman in my neighborhood who goes for a walk, and I very seldom catch her because I don't walk as much as I would want to, or would like to, or even can perhaps. But my wife knows this woman by name because my wife walks all the time. But I saw this woman, and she has severe scoliosis, severe. So part of her body is one way and part of the other is, you could tell she's, physically, she doesn't look well. And I watched her, I was driving and I saw her, and this might sound crazy, but there was an honoring inside of me towards her. Like, wow, it was so beautiful to see this woman. Despite her disability, she was out walking. She was still doing what she could do. And she may not even think or even know that her doing that is not only helping herself, but she encourages others. When they see her doing this, despite her disability, it makes me want to walk. It makes others, you know what I mean? And so it's, the more I do for me, and the more I try to be happy within myself, the more I can give to, as you stated, the more I can give to humanity.
And the term that's coming up for me as someone, a mentor that said to me, edification.
Edification.
When we edify people, when I say, I walk up to the dad on the street who's dealing with a screaming kid, or that mom who looks like she's frustrated, to say, I'm with you. I've been there before.
Yeah.
Keep going. You've got it. That is also, I think, part of this healing process that we as therapists need to practice a little bit more, that we validate sometimes, but we don't challenge ourselves and each other to really show this love and compassion and kindness when it's most needed. We're quick sometimes as a field to say, this is what's wrong with you. But how about what's working with you?
Right. What's right with you? Yeah.
What's built you up? And that's why I got trained in EMDR, because it's this idea that we believe in adaptive memory networks, that you're not dysfunction, but some of our experiences, the internal racism has been stored as that negative belief. I'm damaged. What do you prefer to believe about yourself? I'm whole. And being able to resolve, not completely, but resolve that painful attachment to this belief system, and then find a more adaptive way of living in the world that embraces my culture, my spirituality, my whole personness, as I'll call it.
Yeah, absolutely. Yeah. It's beautiful to me. And I know, I know clients, we have clients who are struggling, trying to maneuver through, this political upheaval and riots, and then the race piece and the COVID piece. And I know it's just a lot to try to maneuver through. And I get that, but I would serve my clients notice, and serve people notice, there's yet beauty to behold. And each person, if you recognize that it's within yourself, that you have beauty yet within yourself to behold, that lets me know that there's still beauty in the world, and if I can embrace that beauty inside of me and give it to others, and others can do the same. I just believe as humans, we have the capacity of righting any wrongs or beautifying any ugly we see in this world.
Yeah, and I think to that end too, it's important that we don't culturally appropriate ways of healing and transformation. And I think we live in this American culture, at least, where I take on someone else's culture for my own practices. My last panelist, Monisha, I think you remember her from Saybrook,
Mm-hmm.
was someone to drive that point home. So I think that's also what I hear you say. If gospel music comes from my background, or maybe it's opera music, so whatever works for you, that old recovery principle, take what works and leave the rest, I think is an important piece of recovery, and not to judge or take on someone else's stuff when it's not working for us.
That's right. That is so absolutely right. I love being I love even what we do. I love being an existential humanistic therapist, uh, because it helps others to find meaning to their individual existence. I love this phenomenological approach where it's based on your worldview, you know, because we all have different worldviews. The only time that what I can't validate is, and none of us can do as therapists, is when that worldview is um, uh, predicated on irrational thinking or irrational behaviors, and you can't just go out and kill people. You can't just hurt people. You know, that type of behavior has to be uh, certainly unlearned and
Challenge.
readjusted. Yeah, challenge. But
Mm-hmm.
other than that, you know, as humans, it's very important for us to, you have to be the best you have to be, no matter what that looks like. You have to be the best you. Be your beautiful self. Be your most beautiful self.
And I, part of the last 6 years that we've known each other has been, you've really modeled that for me, that you never come to the conversation, and I don't think I do, as one or the other is better than. You have more education than I have, but you still treat me as a human being, and you still listen to my insight. You challenge me when it's needed. You help me to grow. And for that, I'm always grateful. And I think that this dynamic that we have is a model, that we can take on into the world with others, that, we don't have to be, someone reminded me, I said, the reason I was getting a PhD at that point is that I could say, I don't know, that I don't know it all. And it's
Yeah.
important for us to say, as quote unquote, the experts in traditional psychotherapy, that I don't know everything, nor do I want to.
Nor do I want to. Oof. And I don't know if it's education or just getting older or wisdom. There's so much I just don't want to know. I don't need to know. Yeah.
My
Yeah.
favorite recovery saying is, there is a higher power and I'm not it.
That's right. Yeah. Yeah. I've used a similar phrase. I'm not the savior. I can introduce you to the savior, but I'm not the savior. Yeah.
So we've been talking for about an hour and change. In kind of bringing this conversation to to its apex and its conclusion, do you have any words of wisdom for how therapists or clients seeking healing in an existential humanistic way, where does one start?
I chuckle because um, I would say I would say you, and I know this isn't a question like answering the question like on a quiz, but you have to tap into is a term me and one of my friends, my best friend, and we've been friends for 30 years. I call him my brother, and we always talk about the human essence. And we say you have to be able to tap into the human essence. I believe that therapy is only as good as, and we know this, as the therapeutic relationship. But that relationship is only as good as the humanization of one another. If I come to you and I sense the microaggressions, or I sense that you are not validating my humanity, and or even vice versa, me as a client and you've been a therapist, or the other way around, if I'm the therapist and you come to me, and there's this this tension that we both know is there, and we can't put our finger on it, but it's there. If I can identify that, and once I identified it and we can get over that hurdle to establish a therapeutic relationship, then we can go on from there to doing great work together. But I think first and foremost, man, it's still going back to honoring and validating humanity, my person, your person. Um, Man, you, if you come to me, you have in that moment that we have, you have to matter more than anything or anybody else in the world in that moment. Your humanity to me must matter more than anything else.
Yeah, I definitely agree with you. And I have nothing more to say on that topic because you hit the nail right on the head,
Yeah,
that it really boils down to this I thou relationship and not it. I can't
that's
treat you as
right.
an object. I have to treat you not as a source of money, but as someone who is, a fellow traveler on the journey, looking to find the same common answers that the rest of us are. Our
Yeah,
circumstances look different, and maybe, where our privileges are, but being able to work within those dynamics to say, you're no different, I'm no better, no worse than you are.
that's right. That's right. And so Michael, I'm so happy. And when we first met, I was drawn to you when we first met at Saybrook, and then down through the years, I was drawn to you. And one of the things that really drew me to you, I have to say, is you were somebody even then, not knowing all of the things you would go through in the next few years or whatever, and all of the struggles. You were one who you exuded a sense of self that 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 I'm so glad you didn't lose that, and that you've only added to it and have become such this beautiful person, this beautiful self. It fascinates me. I'm so happy for you.
And
Yeah,
I appreciate that. And I think a big piece of that for me is it's this internal desire that I can learn a lot from anybody in the world. That one of my mentors wrote in my admissions letter that I have this quality that I'll dialogue with people I really don't agree with. It's to see their point and to treat them as human beings. I think, the approach that you're taking is something I, in an ideal world, try to live out every day. But it's none of us are perfect. And I think you're giving us the invitation to be imperfect in our perfectionism
yeah,
and to strive towards this ideal so that, real healing can take place without this, you know, understanding and unpacking of the brokenness or the unhealedness that we have within ourselves. We can't have the sense of self.
that's right. Yeah, yeah. Wow.
Well, thank you very much and taking the time out of your day to, to give us this interview. Um, any last or parting words to our audience who'll be listening to this, where they can connect to your work if they wanted to learn more about the stuff that you do or your ministry?
Yes, of course, I'm in Colorado Springs, director of Be Real Ministries. You can email me. I'm on Facebook. Also, I do a Therapy Thursday on Instagram with Gods of Groove, Stevie G, which is my son actually, and I'm also immediate past president of Society for Humanistic Psychology. So I'm constantly doing work with that. You can find me through there, and as well as if you have any kind of free time, just look up Rocky Mountain Humanistic Counseling and Psychological Association, because this is the kind of work that we're trying to do, and we're trying to push, and we're trying to become uh, uh, the humanistic hub of the world. And so our work is just predicated on valuing humanity. Um, yeah, I'm very happy to be here, and um, and I just want to just say this to everyone who may listen to this. One of my students gave me some years ago, and I may have shared this with you too, Michael. But I did say the quote in our interview. this kid gave me a teddy bear with some sunglasses and a poster. And he said, Dr. G, this reminded me of you. I thought this would fit you. And when I got home and I opened it up and opened up the poster, and the poster simply said, be your own kind of beautiful. Be your own kind of beautiful. And so I submit that to you and all those you work with to be your own kind of beautiful.
Thank you.
Thank you, Mike.